So I am here with Dr. Ben Neuman, one of the world's preeminent researchers on the coronavirus. Thank you so much for speaking with me.
Thanks very much for having me. How can I
Of,
help?
Give me a little bit of background about yourself, first of all. I know that you were on the team that named COVID-19. Give me some background about you.
Yeah, if you find a new coronavirus, they try to rope you into that team. And so that's what we did a couple of years ago, and that's how I got on. Found one in a frog and another one in a sea slug, of all things, sort of related to coronaviruses. I've been working on coronaviruses since I think '96 was the first time I grew a coronavirus in a lab, and it's been pretty steadily coronaviruses all the way through.
So let's talk about some of the things that are going on. Your group, by the way, Dr. Ben's science group on Facebook is so awesome. I love all the stuff that you're putting out. It's great conversations. And, from what I've been seeing outside of that, there's so much misinformation and not necessarily just misinformation, but people questioning, what is this? What is that? And I think a lot of it comes down to just a lack of knowledge on it. So I want to educate myself, and I think it'll be educating for everyone that watches this as well. So my first question is, there has been this viral, I want to say, documentary posing itself as a documentary
Yeah.
called The Plandemic. And you did a great video on it, which really broke it down on how it's kind of, and you didn't say this, but I'm going to say it, junk science, really.
I think that's fair. Yeah.
And it's a woman trying to sell a book, essentially.
Yeah.
What if anybody watching this hasn't watched your Plandemic video? What in a summary, why is that so wrong?
All the science parts are made up. That would be my problem with it. Yeah. The conspiracy parts you can never really fully prove or disprove, but I don't think any of those are true either. But it involves kind of inventing a virus that comes from dogs and yet can't grow in dogs anymore for some reason I don't know. It's been secretly circulating in Italy for a minute. It's just, it's all kinds of crazy. And I mean, there are ways to test for all of these things. You can do these little tests and you can find the virus and you can show that it's there, read out the sequence of the virus, and there's nothing out there that actually backs up the existence of any of this. And it's based on some really out-of-date ideas that cells can just produce viruses without actually being infected, which for certain kinds of viruses, like HIV-related viruses, yeah, there are so many copies of those buried in our genomes, but there's nothing like a coronavirus buried in our genomes. I think that's the key here. And so it's just not a good explanation. And it's kind of feeding into people's fear already about, I don't know, vaccines and scientists being up to no good. And really, it's trying to turn it into a human-sized problem. It's trying to turn this thing, which is just nature, being nature, into something with a clear bad guy and somebody who messed up and a couple of heroes who can come in and save the day. And it's not that kind of story. That's not how the real world works. Yeah.
So when I was a kid, and still to this day, my favorite show has always been The X-Files, and it actually makes for a great X-File because there's a villain and there's a conspiracy and all that, but it just doesn't seem to hold up to actual science. So one of the things that I find is interesting is a lot of these conspiracy theories have to do with tens of thousands of scientists around the world somehow coming together to either hide X or hide Y. I must say, you guys are the most agreeable bunch in the world.
Right.
That tens of thousands of you can all come in agreement on something and keep a secret.
Does that seem like scientists all marching in lockstep, thinking the same thing all the time? Yeah. No. It's herding cats always with scientists. Yeah.
Right.
Conferences where you go and show up, people are still saying, no, I'm not going to go to that session. I got to go to this other. And yeah, no, nobody can agree on anything, and that's fine. Yeah,
right.
Working in different areas, but yeah, it's surprising, isn't it? I think
is.
The other thing to bring up there is that there are only so many labs that deal with high containment viruses and with coronaviruses. Like, I think I know pretty much all of the coronavirus community. And wherever you're talking in the world, Wuhan or somewhere else, these are people that come to the meetings and have trained in everybody else's labs. We all know each other. There's no weird, evil scientist out there among the bunch, at least as far as I have met.
Right. So speaking of the lab, there's misinformation, potentially information, whatever, rumor that COVID-19 was created in a lab. Is that possible? Is it reality?
In science, you can never say yes and no. See, this is the problem. You can just say something is extremely likely or extremely unlikely. So what we know is that there are billions and billions of bats in China. And what we know is that anytime somebody samples one of these microbats, they're horseshoe bats and bamboo bats, and it's a related group of bats. Whenever they sample them, they find new coronaviruses related to either SARS coronavirus or Middle East respiratory syndrome coronavirus. They're all over the place. Bats seem to carry them for their entire lives. So based on what we've seen, pretty much every bat in Asia and Eastern Africa is infected right now with something related to SARS. And they sleep wherever they like. They don't go where you tell them to go. We just don't notice them all the time. And a world where that can happen, like the odds of it just coming from a bat or a bat to some other animal to a person have got to be billions of times higher than the odds of somebody miraculously constructing this thing. And the virus itself is not identical to SARS. It's got like 1,000 mutations that we've never seen before. And when you get mutations in these viruses, they're almost always bad. It's a thing I call the Spider-Man paradox, where we know that radiation causes mutations. And yet, despite all of the Fukushimas in the world, we have not yet had one Spider-Man. We only get cancer and death.
Right.
Because mutation is bad. Unless you've got natural selection and a whole lot of time, then you can actually build up these mutations. So yeah, this is a virus that is probably something like 100 years removed from SARS coronavirus 1. And it's just been out there in nature. It's one of these many, many viruses that we're going to have to get good at dealing with because they're going to be coming back.
And is that actually is a great lead into my next question, which is there a treatment available now? And if not, how long are we talking before reasonably a treatment could be available?
Yes, there's a couple reasonable ones that are out there. So there are people trying these things called IL-6 blockers, which is an antibody that they actually make, so a little component of the immune system, and put in to shut down your protein called IL-6. IL-6 is a messenger, and it sets off this thing called the cytokine storm, which is where you get all the disease from in SARS coronavirus. And so those might work, but we haven't seen a lot of data showing that they do work yet, but the theory is sound. Also, there's remdesivir, seems to shorten the amount of time that people are sick, but it doesn't seem to make a big difference in people who have really severe COVID symptoms. And so probably you're going to be talking about some kind of solution that involves both a drug to target the virus, or maybe 2 or 3 drugs at the same time, and maybe 2 or 3 drugs to target the immune system, which is causing the damage, plus really good medical care. It's one of these things where it's going to take a lot of moving parts coming together, I think, to solve the most severe cases, but it can be done. Yeah, it just takes a while to test all these things out, and you got to make sure that the treatments are safe and effective, and that's the key.
And how about vaccine-wise? I've heard multiple things. Some, and I'm sure there's multiple teams working on different vaccines. How realistically, how far do you think we're out from this? Are we talking a few months or a year or 18 months?
Yeah, so if we can put our Pollyanna hats on, we can say, yeah, all right, if everything goes well and the first one is a resounding success, then the first one's already in trials, and so they'll have the results from the first trials probably within the next month, and then they can go to phase 2, at which point they can start actually vaccinating people. And you're talking to there maybe 2 months to get the results and make sure they haven't done something that affects a small percentage of people really badly. And then, yeah, once you get to phase 3, we can just start, boom, compassionate vaccination for lots of people. So yeah, 3 months, if everything goes perfectly. I doubt everything's going to go perfect. Right. I think the knock on most of the vaccines that are being tried right now is that they are making this possible mistake of being too safe and maybe not hitting the immune system hard enough. It's a nice thing to do. You're making it so that anybody can take this, even like a little baby, and not get sick for sure. But the immune system seems to work better when you really stress it out. Like the closer you can get to actual sickness, generally the stronger immune response and the longer lasting immune response you can potentially make.
Wow.
The virus does a lot of things to shut down parts of the immune response. And so this is a virus that's very good at basically hiding from you. And there isn't a strong indication that any immunity that we develop is actually going to last very long. So if we do get this vaccine and it does work, it's still going to be a thing you need to take every year, like the flu vaccine. But that's okay. Yeah. Small price to pay, I guess.
And with the immunity question, do we know that if you get it, you can't get it again? And if not, do we know how long that immunity might last?
Now, this is a question that we'll be able to answer when it happens, when somebody gets it again twice for sure. Right now, all we know is what happened with the original SARS, which that was a small enough infection, something like 8,000 people, that nobody got exposed twice, as far as we know for sure. But we do have a lot of other human coronaviruses. There are 7 of these things, and we know that you can get more than one human coronavirus at the same time. So they don't protect against each other. And we know that you can get the same human coronavirus again, something like 1.5 years after you got it the first time.
Wow.
So it's probably going to be something like that. It may be as short as 1 year of immunity, or a little less than that. You may get to 2 years, but that's probably pushing it. And we've already seen that there's a really variable response. Some people make a great immune response really early. Some people make a terrible one. These people can all survive, but if you survive having made a partial immune response, you're not going to have protection against a second infection, most likely.
So that immunity doesn't necessarily mean you're not going to get it again. What it means is, much like I would assume with like a flu vaccine, if you did get it, your response would most likely be lessened. Is that correct?
I think that is the idea. You'd have less of a disease, but possibly it could work if you had good neutralizing antibodies, and they all happen to go to the inside of your lungs and wait there, and then they can catch the virus, and you just wouldn't get infected. Yeah, that would be the ultimate goal, but it is very difficult to find a vaccine that actually works like that. We don't know how to do this. If we did, this would all be much easier and much faster.
Right.
Yeah.
So in regards to masks, it seems like we were told at first, don't wear masks. It's for the health professionals. It'll protect them. Now we're told we probably should be wearing masks. Why is there, and that could totally be my reading of it, but why was there a difference, and does that work?
Yeah, different kind of masks. So there's a thing called an N95 mask. It's that little white thing with usually a yellow box on the front. That's the most common one they sell here. That thing is tested and guaranteed to actually prevent against, amounts of virus that could potentially infect you. Those are the ones that are needed in hospitals, and those are the ones we're trying to get people not to just, buy up and hoard and, sit on your stack of masks or something.
Yeah. Like toilet paper.
Because when a doctor uses one of those, if they've gone into a room with somebody with COVID, then there's going to be COVID on the outside of the mask. There's going to be the virus there. And so they have to dispose of that mask every single time. There is not currently a disinfection protocol. You can't reuse those masks. And so they burn through them at a fierce pace in the hospitals. Regular masks, like a bandana or like one of those cloth ones that they sell down at the Middle Eastern restaurant here in town, those things are fine. And what they'll do is they'll catch respiratory droplets. So we think it takes something on the order of probably 10,000 to 100,000 actual viruses landing inside your nose or mouth to get you infected. And it's not because one couldn't do it. It's like they're lottery tickets, and you got to buy a lot of tickets if you want to get, win, although it's not really winning.
The worst kind of lottery ticket, I think.
Yeah, the worst kind. And so you're not going to get those. Breathing in viruses 1 or 2 at a time. You'd have to just sit right in front of somebody who's breathing at you all day. But if you pop your peas or just, cough or something like that, you can get these little chunks that come out, and they are going to have thousands of viruses in them. And that's probably how this is going to spread. And those little blobs aren't going to travel very far, and they're totally going to get caught by a mask, either on the way out or on the way in. So you're protecting yourself, you're protecting everybody. It's not a bad thing at all.
Right. And, I try to never get my information from memes, but I saw a meme that I thought was pretty cool that shows somebody peeing, and it's like, you wouldn't want this spraying on you, so you do this. I don't know if you saw it.
I did not see that one yet. No.
But it was like nothing else. You are giving yourself a buffer of some sort, which is much better than not having anything at all.
There was a study that came out, or I don't know, it at least made news fairly early in this. And it was dealing with the amount of bacteria that came out of one's backside. And they found that even a thin layer of underwear pretty much stopped all the bacteria coming out. Yeah. So it's actually fairly easy to stop those little droplets, if you like, and contamination. Yeah.
Right. Yes. It always resorts to toilet of some kind. But
Always does.
there is information, whether false or true, that is saying that doctors are purposefully coding patient deaths as COVID so the hospital can get more money or whatever. Is this at all true? I mean, obviously there might be an outlier or something, but generally this is not happening, I hope, right?
It's like training day,
Right.
but in the hospital. Yeah.
Right.
I haven't heard for sure that this is happening. I think this is people worrying that it might be happening. What we do know, though, is that there are these giant spikes of death. The Financial Times is keeping track of them. And so you'll have a spike of death that's like this big for all the cases that we know are COVID. And yet you'll have this many extra people that have actually died during that time, which are all in some way, directly or indirectly, going to be related to COVID, because they're comparing this year's statistics to last year's statistics, adjusted for population increase. And I think we're still undercounting deaths by a factor of, 2 or 3. And we're probably undercounting cases. There are different estimates out there, but there's probably about 10 cases out there that we don't know about for every one that we do.
Wow.
So bad as the stats are, they're really much worse. You're only seeing the bottom tip of the iceberg. I don't know.
Yeah. And again, that's the worst iceberg, just like the worst lottery ticket.
For sure.
Yeah. And is that because we're not doing enough testing?
That's it.
Okay.
Well, we're not doing enough testing, and we're not testing necessarily the right people. So you want to be testing everybody who's had close contact with every single positive case. And that's how you find it. Because if you don't do that, the virus has about a week where it can grow in a person, and you can't test for it. You can't actually detect it because you need to be pretty infected before the test works. And so in a situation like that, the virus has got a weak head start on us. And this is the way we get it back, by tracing all the people around and telling them, this person's sick, so you're going to stay at home for 2 weeks. And we're going to call you every morning, and you're going to take your temperature with a little thermometer. And the first sign of anything, we're going to get you in for a test. Yeah. And that would stop the virus. That's it.
And that's called contact tracing, right?
That is contact tracing. Yeah. And in a world where we have 14% unemployment this morning. Yeah.
Yeah.
And contact tracing requires fairly little skill, and you're going to be paying these people an unemployment check anyway. Why not, pay them to do contact tracing?
Right.
It would seem to me. Yeah.
So, and I meant to ask you this when we were talking about vaccines, but there's no way to implant a chip with a vaccine, right? Bill Gates, evil Bill Gates, and his tracking chip vaccine.
There would be ways that you could put something inside under the skin. So there's this sugar needle vaccine thing where you put a little bandage on, and we don't know that it actually works yet in people. But there are a lot of interesting ways you could deliver a vaccine. So one of the problems with the vaccines that they're trying is they're just putting in usually one protein from the virus, or the gene that makes that one protein, at a time. And they do it for a little bit. And the problem is that your liver is very good at its job, and so are your kidneys. They demolish this stuff. They pull it right out of the bloodstream. And so it's just gone within minutes. And then you can go in for a couple injections, but each one is giving you, what, 15 minutes, time
Hmm.
with the vaccine. And the idea is if you had some kind of slow release mechanism, some kind of little implanted thing that could just drip out the virus constantly, like an IV drip, then yeah, you could have people that could actually move around in the world and get vaccinated. It's not a bad idea. It just hasn't been shown to work yet for coronavirus, but yeah, it's worth trying. Yeah.
So that's what the whole implant thing is. It's not sending your location back to Bill Gates' lair or something.
I would hope they wouldn't do that because that would be weird and he would end up looking really bad.
Yeah.
That would just make people crazy and they'd never want to. Oh, yeah, no, that would
Yeah.
be such a bad idea.
And of course, I'm being sarcastic about evil Bill Gates. He's been a
Looks like
huge,
he's trying. Yeah.
yes, yes. A second wave, is that, I mean, we're really not out of our first wave, but is this thing going to go away over the summer or dampen and then come back roaring in the fall? Is it just not going to go away at all? What are we
Yeah.
looking at?
So we used to live in San Diego, and I was never good at surfing, but there were these really good waves you could sometimes get at the right time in the morning, and they just go up and they just be constant, 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 right across. That's what we're riding right now. We've got to, instead of having a peak like all the nice little model show and the places where they shut this down, the US as a whole is just stagnant. We've had about 30,000 cases per day for the last, I don't know if it's 21 or 25 days, but that's ridiculous. We're kind of stuck at this level right now. And yeah, the idea of opening up more, which is happening in some places, not others, just seems like it's going to make the wave go up again rather than down. And that's what everybody wants to see.
Yeah. There is this question about herd immunity.
Yeah.
How does that work? Does it work for coronavirus? Do we have to get 80% of the population to have had it? Tell me a little bit about that.
So yeah, well, does herd immunity work for flu virus, for example? So there are viruses where yes, something like old school smallpox virus. You got that thing and you either died or you were immune for life. Those are your two choices there, and your body makes one of them for you.
Right.
And so a virus like that, yeah, once everybody's had it, theoretically, you only have to worry about the new people coming into the world, babies essentially. But they are always coming in, and so that is still a risk. They're the ones, you're shifting the risk to them essentially. With the rest of herd immunity, there isn't any real indication it's going to work for coronavirus. All the indications so far suggest that immunity is going to be kind of short term in people. And even if we have vaccines, it may not actually work, this idea of herd immunity for a coronavirus. Just so many people respond so differently to this virus that, yeah, I don't think you can actually count on anybody having either the virus or a vaccine and making a response that's definitely going to protect them again. Mathematically, I can see why it makes sense, but in the real world with this one, I don't think it's gonna. We've had the flu vaccine for how many years now, and we still have to get it every year because herd immunity does not last, and a lot more people get the flu still. We're catching up. Eventually, we'll be able to say that nope, more people have had SARS-CoV-2. Yeah, we did it, guys. But
Right.
I don't want to go there.
So, hope. Why are you hopeful that this isn't the end of the world or end of 10% of our population or whatever?
Yeah, because some countries have tried to knock this thing down and they've been really successful. They have knocked it right down. We have not yet really started trying to do that as a country. You got this piecemeal approach where some states are really going at it, like New York is knocking it down. Hawaii and Alaska, surprisingly, yeah, their curves are right down, and that's fantastic. But I guess they're naturally isolated. Montana's
Right.
doing okay too. But, yeah, that's Montana. Yeah. Pretty much every place where there are people, yeah, every other place,
Right.
the curve is either flat or going up a little bit. And so that's why we have this sort of flat line across the whole US. It's a mix of ups and downs that just about even out. And we could all be like those places that are doing a really good job of contact tracing and testing. Yeah, It's that easy. That and the staying a couple feet away and wearing a mask. Oh my gosh, yeah, this is the opposite of rocket science.
And then, so if we can't, I can't control, none of us can control what our state or federal government is doing.
We
So,
can,
right. So what I can do to protect myself is follow social distance, wear a mask, wash hands, stay away from sick people, all of that kind of stuff.
yeah, and just like you're going to wear a little pink ribbon during Breast Cancer Awareness Month or whatever, yeah, we can wear a mask and we can show the other people that are out. It's like, okay, we're on the same side. We both want the virus to go down and go away so we can get back to normal. Yeah. It's basically saying, I'm not trying to actively kill you,
Right.
fellow citizen. Yeah.
Right.
Which is a nice message in these sort of fractured and contentious times.
Yes, you would hope that would be one thing every single person could agree on is, hey, I don't want me to cause your death. So
Right. It seems like a basic, the level one of society. Yeah.
Doctor, thank you so much for this conversation. I really think it's going to help so many people. Where can people follow you?
We have Dr. Ben's Science Group on Facebook. That's a good spot. We have a little tiny YouTube channel, but we only put occasional videos on there. It's just more work. Yeah. So the Science Group's a pretty good place. And then I'll just be there watching whatever's going on in the papers, like scientific papers, not the other
Right.
kind. Yeah. And reporting back and answering questions. I think if you got questions, that's a real good place. And you ask questions, it gives me something to talk about. And so that's good. Yeah. I like coronaviruses, just not this one. Yeah.
Right. Doctor, thank you so much. I really, really appreciate your time. You are a wealth of knowledge. And thank you for what you're doing and trying to, not only educate people so it's not so scary, but it's understandable, but you're also on the front lines to try to, end this. So thank you so much, Doctor.
Thanks for trying to do this. It's good to bring people this kind of stuff. I appreciate you doing that. Yeah.
Thank you.